Now we move on to the physiological disturbances they can cause. Okay, here as a physician, I have a temptation to start discussing the diagnosis part or the treatment part, but here in physiology we are more concerned about the disturbances those leukemic cells can cause in the body. Okay, so we move on to the physiological disturbances associated with leukemia or their effects on the body. Well, here we have listed the most common effects of leukemia on the body. Okay, and to begin with, the first one is marrow failure. The bone marrow actually is a closed compartment. Okay, it has a specific allocation in terms of space for different precursors types. Okay, for example, the red blood cell will occupy a certain space in the bone marrow. Here in case of leukemia, for example, with this one, if there is abnormal expansion and uncontrolled proliferation of this colony, it will take up more and more bone marrow space. Okay, and we don't have a problem with that, but that will be at the expense of red blood cells. It will suppress the surrounding normal precursors. The red blood cells will be suppressed and platelets will be suppressed. That expansion is the cost of other normal cell types. So as a result, even though we will be getting more and more increase in the number of white blood cells, the number of erythrocytes and platelets will decrease proportionately and cause problems. If we have less platelets than normal, we have bleeding problems. If we have less RBCs than normal, we get hypoxia. Okay, so they cause more marrow failure owing to their uncontrolled proliferation. Okay, well, the second most worrisome feature is their ability to spread both locally and to distant places of the body, and they behave like the same at distant places as well. For example, it was showing uncontrolled proliferation in the bone marrow. Once it spreads through the hematogenous route to the liver or spleen or brain, they start behaving the same at those places. They start producing their copies at those places, extramedullary hematopoiesis. Okay, so their potential for spread makes them even more dangerous. Okay, and the third one I will like to add here is possibility of decreased immunity. And how would that occur? We mentioned earlier that leukemias, particularly the acute variants, acute leukemias, tend to produce poorly differentiated cell types. They don't resemble their parents in appearance and in terms of function. If they are immature, they don't resemble their parents, they are not combat ready. So even if we have a high numbers of them in circulation, since they are not combat ready, so the immunity, particularly in case of acute leukemias, tends to be compromised. The immunity tends to be lower than normal in most cases. Okay, and next one is the metabolic load they impose on the body. Okay, so during normal hematopoiesis, this process, we are not talking about leukemia, we need to provide continuous nutritional support. Like for example, in case of RBCs, we have to offer a continuous supply of iron, since it is an essential component, amino acids and other hematinics like folic acid, vitamin B12, vitamin B6, etc. to be able to produce good RBCs. Now, if a certain clone is producing abnormally in an uncontrolled fashion, so that depletes the existing pool of amino acids and other nutritional substrates. Okay, so that finally the body is under metabolic load. All those precious nutritional sources are taken up by the leukemic cells. Okay, so for this reason, if we talk about the cardinal symptoms of leukemia, we have asthenia, weakness. They feel very, very weak, fatigue. Okay, and by the way, the other one is anemia, the second A. Anemia, asthenia, and of course anorexia. Okay, and the last one here at number 5 is the tendency to cause hyperviscosity. So normally we have, as we mentioned earlier, we have about 4,000 to 11,000 of white blood cells in each cubic millimeter of blood. So if there is uncontrolled proliferation, the output increases proportionately. For example, if they produce five times the normal their normal capacity, we will get 11,000 by 5 multiplied by 5, 55,000 of white blood cells in per cubic millimeter of blood. So that tendency to cause hyperviscosity is lower down the list, but that still is a significant feature. And hyperviscosity, I want to add, predisposes to thrombosis. An increase in the cellular elements of the blood is what we call hyperviscosity, and that predisposes to clotting within the blood vessels, thrombosis. Okay, now the most common problem during exams is we ask them what are the common side effects or the common effects of leukemia, and the students most of the time have a temptation to begin with, it causes hyperviscosity. Well, that is absolutely right, but what I want you to do, let it be in a descending order. Okay, hyperviscosity is not that important. Okay, we just have 4,000 to 11,000 per cubic millimeter of white blood cells in each cubic millimeter of blood. In contrast, if we compare the number of red blood cells in each cubic millimeter of blood, so that is well over 5 million of red blood cells in each cubic millimeter of blood. Okay, so if their production rate increases to 10 times normal, okay, and here we just experience 1% increase in the case of RBCs, so that is going to be far more significant as compared to the increase in numbers of white blood cells when we see it in the perspective of hyperviscosity. So let it be much lower down the list at the bottom. You better go for a descending pattern. Okay, take a start with marrow failure and so on. Okay, so this was about leukemias. If you have any question, suggestion or objection, please let us know in the comment section and we will try our level best to get back to you. Thank you very much.